Hello everyone and welcome back to the channel. It's Ben here, and in today's video we would be looking at the question types to expect on the Nclex-RN exams. So over the last few weeks we've been looking at a series on the Nclex-RN exams, trying to understand what it all entails. And so in today's video we will be looking at the question types one should expect on the Nclex-RN exams. Well, if you are new to this channel, welcome to the channel. I would inquire of you to like the video, share, and subscribe to the channel. And to all my returning subscribers, thank you for following the channel. And I hope this video brings value to your time. So like I mentioned earlier, we'll be looking at the Nclex-RN exams and what to expect on questions or the possible question types you can find on this test. Now we need to understand what every question entails. So in every question, there are three things that will be present in the question. You've got one, the stem of the question, and then you've got some distractors, and then you have the correct answer. So one will ask, what then is the stem of a question? Basically, the stem of the question describes a client situation or a client's problem or the healthcare needs of the client. And sometimes you will find some other relevant information to the client case. So basically, the stem of the question tells you everything you need to know about the client and what is wrong with that client. And then at the end of the stem, you find either a question or an incomplete statement where you would have to find an answer that actually completes that statement, or you get a correct answer to the question that may be asked. And the next thing to look for is what we call distractors. So in every test, usually you have multiple choice questions, except for those ones where it is a drag calculation question where you would have to calculate and input your answer into a space that is provided. But most often, there are some wrong answers and the correct answer or answers. So you find that you've got some distractors, something that will drive your attention away from the main answer to that question. So for distractors, usually you will find out that these are somewhat logical answers, but may not be appropriate for the client situation. Also, some distractors may be based on things that have actually been given out in the question or in the stem of the question. And then sometimes it may be a common lesson practice which is wrong, but then it's put there just to distract you. Then finally, we've got the answer to the question that is being asked. Now, it is worth noting that these answers to these questions are not based on recall. So it's not something you learn and try to recall. It's usually you applying what you have learned that is pertinent to the disease process or the patient problem. So it's not a matter of recalling, it's a matter of application for most of the answers on the NCLEX exams. Now, having understood what the question entails, let us look at the question types that are likely possible for you to see on the Nclex-RN exams, and then we'll try to explain how you can answer such questions. So there are about 14 different types of questions you can find on the Nclex-RN exams, and then I'll go through them now, and then we'll look at them individually and how they are scored on the test. So the very first one is the most common one, which is a multiple choice question. And usually there are 3 distractors in this question and 1 correct answer. We've also got the multiple response question. So you've got a question and you've got like 6 separate answers, from which 3, 2, 4, sometimes even all the answers may be correct, and you are asked to select all the correct answers. We've also got what we call the matrix multiple choice questions. And as the name suggests, all these have got multiple answers, and either you choose one or more, depending on the type of question it is. Also, we've got the drop down clause. So we've got the drag and drop clause. So usually you find a scenario and then you are asked to drag and drop an answer into the correct bit. Also, we've got the drop down table. So we've got a table, and then once you click, there are multiple choice, and then you pick the correct answer. And then you've got what we call the bow tie questions as well. This is more the introductions on the next generation Nclex. So usually you realize that you've got a question or the answer format comes in a bow tie like shape, and then you put in the correct answers as and when you see them. There's also the multiple response select all that apply, which we usually call as SATA. So select all that apply, you are given multiple answer choices, and you select everything that applies to the client scenario or the client problem. You've got the highlighting text and highlighting tables. So you realize that there's a sentence for which you can highlight stuff, and then the things you are highlighting is usually the response to the question that is asked aforehand. We've also got the drop down rationale and then the drag and drop rationale. So usually you get a sentence and they tell you, why are you doing this? Or a patient is likely to develop this disease condition. Why is that? And you get a rationale where you also drag and drop the rationale. And then finally, we've got the multiple response grouping and the matrix multiple responses, which we would look at individually in the video ahead. So now we want to quickly look at multiple choice questions. Usually this is a classic approach to scoring exam questions, and you get 1 for a correct answer and 0 for an incorrect answer. So for ones where you are supposed to choose multiple correct answers, you get 1 for each correct answer. And usually in this type of questions, there are no negative markings. We have an example, as you can see on your screen now. It talks about which of the following actions should the nurse take. Then you realize that the answer or the correct answer is D. So you just choose D, and once you get it correct, it's 1 mark. And then if you get it wrong, like the one that follows just after that, which of the following actions should the nurse take? Administer intravenous fluid, which is the wrong answer. You don't get anything for that. Now, I should say this is public information that I took on the NCSBN website when they explained what to expect in the next generation Nclex question. So this is something that is available and you can find on NCSBN website. Now we've got the matrix multiple choice. Now what we find in these is that there are multiple choices and there are multiple answers. So what you realize is that you treat each role as an independent question, and you are trying to use the correct or the false answer. Usually you're looking for the correct answer. So each role is treated as a separate question. Just like you can see on the screen, you've got assessment findings and you're asking whether this has improved or this has not improved. Usually this will be based on a scenario that you've been given earlier, and all you need to do is choose for each section, like the blood pressure. Has that improved or has it not improved? Is the nausea improved or not? Is the pain improved? So you treat each role as a separate question. Usually for scoring on this type of test, you don't get a negative scoring. So if you get a question wrong, it is wrong. And then if you how many correct you get those marks given to you. So there are no negative marking on this type of question. The next type of question we'll be looking at is the drop down clause. So you complete a passage by selecting one or more drop-down options, which completes the paragraph. There can be 3 to 5 options in each drop-down box, and what you do is that you select one. These questions will be based on some scenarios that have been already given to you or that have already been established. Sometimes you will find it as part of a case study, and it can also be a single question on its own with its own scenario. In terms of scoring for the drag and drop down clause, it is usually 1 for a correct answer and 0 for an incorrect answer. So you don't get penalized for getting an answer wrong. So as many answers as you get, that is recorded for you as your total in this type of question, the drag and drop close. The next type of question we'll be looking at is the drop down table. So this is more like the drag drop down close, but this is more in a tabular form. And usually every correct answer you get is summed up to give you a total for that question. And you also don't get negative marking on this question. And so as you can see, you realize that there are body systems and potential nursing interventions in this example, but usually you should know that a case scenario would have been given previously for which you would pick answers from. And so usually that's how you get it in this type of question. It is in the tabular form, but it's a drop down table and you choose the correct answer as you go along. The next item we'll be looking at will be the bow tie question. So for the bow tie questions, usually you have 3 different sets of categories for which you would be choosing answers from, and it's most often a disease condition, an action to take, and either parameters to monitor or signs and symptoms you would expect with that disease condition. So for instance, if you take someone who has come into the ED with high blood pressure, usually what you are looking for is high blood pressure as the main disease condition. What parameters do I monitor? So do I monitor the heart rate, do I monitor the pulse, do I monitor the level of consciousness? And then you also find that you are asked, oh, for instance, what complications can be associated with such a disease. And so you find out that you are having cerebrovascular accidents, Bell palsy, seizures. And so this basically gives you information about one condition, but you've got 3 different categories for which you will be examined on the actual test. Now let us move on to multiple response select all that apply, what is previously known as SATA. In this kind of questions, you usually have multiple responses, and then you've got correct and incorrect answers. So they have the distractors and the correct answers, and so you are asked to pick or choose all the correct answers there is in that question. And in these type of questions, there is negative marking. So let me explain what I mean by negative marking. So if you get one answer correct, you usually get 1 point. But if you get a wrong answer, then you get minus points. So if you should get 3 correct answers with 1 incorrect answer, you usually get a total of 2 marks for that because there is negative marking on this type of questions. Now we would move on to the highlighting table type of questions. So usually in a table, you've got like a history and physical assessment of a patient, and then the question asks you to say, click or highlight those ones that need immediate follow-up. And so you are reading through the assessment findings you have, and you are seeing which of these assessment findings I will need to follow up on immediately and which ones can wait and be addressed later. In this type of question as well, you usually have negative marking, so it is plus or minus scoring. And so if you get one answer correct and another wrong answer, that cancels itself, means you've got nothing for that question. Similarly, you've got the matrix multiple response questions. So this is more SATA, but you treat each row as a different set of SATA questions. So like what you can see on the screen, we have assessment findings from a scenario that we already had previously, and then we're looking at what signs and symptoms are present and in which conditions. So for instance, when you're looking at appetite, is appetite affected in bowel obstruction only, or is it also affected in appendicitis and ruptured spleen? So if it's affected in both conditions, then you choose 2 of the conditions and leave the other one. You can't choose every condition if the symptom is running across all 3 conditions you have been given. And as well, this is a plus or minus scoring rule. And so if you get a wrong answer, you get subtracted a mark for getting an answer wrong. And so just to explain this further, you realize that on the PowerPoint presentation you are seeing now, you find out that once you get a correct answer and then an incorrect answer for a particular question, you get 0 points for that. But then when you get one correct answer and two incorrect, you still get 0 for that question, but it would not be taken out from another answer you may have right, because each role is being treated as a separate SATA question on its own. So we've got the multiple response grouping, which is also following the plus or minus scoring rule. So I'm just going to read this example for us and then we'll go through it and see how this works. So it says, for each body system below, click to specify the potential nursing interventions that would be appropriate for the care of the client. Each body system may support more than one potential nursing intervention. And we look at the body system, we look at the potential nursing interventions. But usually these ones would have been based on a clinical scenario that you have in the stem of the question. And so when you take your neurological assessments, are we doing that every 2 hours? Do we need to do a CT? Should we give some pain medication? Or do we need to do an EEG? So based on the clinical scenario, you choose either 1, 2, 3, or 4. Sometimes all the nursing actions may be required for that particular scenario. And then we should understand that you need to select at least one option from the multiple response grouping kind of questions. So we've got the drop down rational types of questions. So usually it is an incomplete sentence, and then you just click on the drop down menu or button, and then you select the correct answer. So with this, it's usually one answer per space given or per drop down box, and you can sometimes have at least 4 or 5 different options to choose from in this kind of questions. But you should know that it is always based on a rationale. So the client is at risk of developing, say, hypoxia, as evidenced by the client's respiratory assessment. Is the person using accessory muscles to breathe? If yes, then okay, I'm saying that hypoxia is likely because of this assessment I've done. So it's usually based on a rationale. And then the next one will be the drag and drop rationale. So this time around, instead of a drop down box, you need to drag the response into where you would want it to be. So you realize that you see sentences like as evidenced by, due to, because. This one tells you that this is a rational type of questions, and usually it's either a drag and drop or a drop down to get the rationale and the reason for which you are saying that is likely going to happen together. So looking at what we've been discussing so far, by way of summary, we looked today at what the Nclex-RN questions entail, and we say usually you have a step which tells you about the disease condition or everything you need to know about the client. Then at the tail of the stem, you find a question or incomplete statement for which you have multiple responses you can choose from, which usually you would find some distractors in there, but usually there's also always a correct answer. Depending on the question type, it can be either one correct answer or two correct answers. And I did say that in some of the questions, there may be no distractors. For instance, a question that wants you to calculate the amount of medication a person may be given based on a prescription wouldn't have any distractors, because you would have to calculate that yourself and input the correct answer. So having understood what the question entail, we then looked at the types of questions that can be asked, and then we realized there were about 14 different types of questions that can be asked. But we established that fundamentally it is you getting the correct answer for each question that have been asked. We also try to establish what the scoring systems looks like, and we established that not all questions have negative marking. So part of the questions you would have where you don't get penalized for getting a wrong answer. And in some other question types, you will be penalized for getting a wrong answer. And so thank you very much for staying throughout the video. We really appreciate your time. I hope this video gives you value for your time. If it has, hit the like button, share, and subscribe to the channel, because on here we bring you all that entails the Nclex-RN exam, as well as some international exams for nurses. If you've got any questions, any concerns, do leave a comment down below, and then we'll come and then answer in due time. Thank you very much for watching, and we'll see you in the next video. Bye bye.